Okay, got myself back on track. I still haven't mastered the flipping back and forth on this program. But the first healthcare communication, or actually second one after ethics, is communication. And with communication, you want to be aware of things like body language. Your body conveys a lot of information. I'm not going to go into a lot of depth about that. You also want to avoid, to the extent that you can possible, medical jargon. So verbal communication in a profession has its own special needs, and almost all professions have their own language. And medical language is no different. So a person who works in the healthcare environment as a professional tends to speak on a level generally not understood by a layperson. You go to school for a lot of years to learn the language, and then you have to unlearn the language. That was one of the hardest things that I had to learn how to do after going through OT school and then becoming a school-based occupational therapist and working with, parents and trying to explain to the parents, your child has difficulty with elbow flexion, and that means nothing to them. What they care about is that their child can't bend their elbow. So you have to, consider your audience for one thing. That's really important. So you can use the terminology, and it's great to know the terminology, but the whole aspect of communication that's important to remember is that you have to have a sender and a receiver. And if the receiver can't get that information, then we don't have communication. I could say that, Betty had a massive intracranial contusion resulting in hemiparesis, or I can say that Mary had a bump on her head that caused one-sided weakness. So you have to think about the person that you're communicating with and know your audience. So effective communication within the healthcare environment is imperative. We need people to be able to understand what it is that we're saying, because as healthcare professionals, we're communicating with patients and families and other professionals and the general public. And that can be all within a 10-minute period. So it's important to know your audience, and then be able to tailor the message to the audience. You're not going to say that Mary had a bump on her head if you're talking to Mary's doctor. So it's important to tailor your message to whoever the receiver is. I apparently am button challenged today. Just to briefly talk about something we did talk about in Gen Med, but I do want to touch upon again because it's appropriate for this course, is charting. And that client's chart is a permanent record, and it's a permanent means of communication between the healthcare providers. So there are a lot of purposes to that medical chart. It, provides for coordinated planning and continuity of care. So you know who's doing what, when, where, and why, and how. It also is a legal record. There are standards that have to be met, and that's whether they're met or not is going to be judged based on that chart. It's also the basis for evaluating quality of care. So what was done and how was it done? Also baseline for reviewing the effective use of client care services. So is what should be being done. It provides data, and it has to be legally sound. So just some basic guidelines that we have talked about in Gen Med. You need to use permanent ink, and you need to write legibly. Some facilities require only black ink, and now some facilities are requiring only blue ink. And the reason for that only blue ink is to know that it's not a photocopy, although in the era of really good color copiers, that's getting more and more difficult to be able to do. You should never alter a chart. You draw a single line through an error and initial it, so no scribbling it out, no whiteout, absolutely no whiteout. Just one line through it, and you can either write error next to it with your initials or just initial it. Never chart for others. People are going to ask you, can you just note that Billy took 14 steps during PT today? And if you're not the PT that actually walked with Billy and took those 14 steps, you should not be charting for Billy. Never leave any spaces. If there's a space at the end of a line, you should draw a line through it and then sign it so it's clear that there's nothing missing or anything taken out. Only use institutionally accepted abbreviations. So each facility will have approved abbreviations. You will know what they are. It's important to know what that facility uses. You will learn medical abbreviations throughout your whatever program you go into, and throughout the rest of your you will learn what some medical abbreviations are, but they can be different from setting to setting. And the perfect example that I try to use to illustrate this, and I used in Gen Med class, is HOH, which in a geriatric setting means hard of hearing, whereas in a pediatric school-based setting, for me, if I used HOH, it meant I provided hand-over-hand assistance. So you want to know what are the approved abbreviations for whatever setting that you're in. Always use correct spelling. I can tell you from personal experience with parents, you lose all credibility if you do not spell a child's name correctly. So you want to use correct spelling. That is a reflection of you. Always be objective, not subjective. You should not be inserting any of your opinion in a chart. It should be just the facts, ma'am. Never comment on other staff members within the chart. That Mary, the PT, just was off her game today. She just didn't walk him very far, or she made a comment that was inappropriate. The chart is not the place for that. Those kind of things should be followed up on, but not within the patient's chart. If you're going to document a problem, document your intervention. So if you notice that Billy, when you took him for that walk, had a little bit of a loss of balance, you're going to refer him to PT. You're going to recommend that he is a fall risk, so we need to note that on his door. Whatever it is. So if there's a problem that's noted in the file, you want to note the solution. Always be accurate and clear. If you're not sure of something, use NA for not applicable rather than leaving any blank spaces. NA infers that you considered whatever the prompt was, whatever the question was, and it's not applicable, versus that you just didn't do that part. Okay, next competency that we have is time management and organization, because we're talking about these because both are essential to practice. Time management and organization are absolutely essential. As a healthcare provider, you're going to be operating on a schedule and will be legally and ethically mandated to provide services that are at specified intervals and for a defined duration. So if you're supposed to see someone for 3 times a week for 30 minutes each session, you need to see that person 3 times a week for 30 minutes each session. So you have to have good time management skills to do that. You also need to make sure that you are prepared for your sessions, whatever it is. You're mandated to provide services for a fixed period of time, so that's not the time to be looking for supplies or to be reviewing the chart or something, whatever else it is. That 30 minutes or 45 minutes or whatever it is that patient or client's time. When I was an OT for a school district with 13 schools, we did have 3 OTAs. Also, there were 2 OTs. We were responsible for all of the evaluation and treatment planning for all of the schools. Now, I want you to consider the fact that we were 2 OTs and we completed more than 180 evaluations in a school year. The school years are 181 days. We both had more than 70 students on our caseloads for direct treatment. We supervised the OTAs. We did all of the documentation, attended the meetings, and traveled from school to school. You can't do that without good time management skills. You also have to think about the productivity demands, particularly in clinic-based settings. So you may work for a facility that requires a certain degree of productivity. And productivity is defined as direct service, not documentation, not retrieving patients, not going to the bathroom, whatever it is. It's direct patient time. So again, time management is key. In order to have good time management, you must be organized. You can't make the most of your treatment session by getting your materials and having that patient sitting and waiting for you to begin. That's not what their treatment time should involve. And that's going to reflect upon your technical skills to the person. So again, important for as a leadership competency. Those organizational skills have to be practiced in order to be integrated into your repertoire of behavior. So it's important to consider those as you are now working towards becoming a healthcare practitioner. All right. So preparation is the next competency. It goes right along with that time management. You need to be prepared. But so I just included in here, what are some implications of not being prepared? The client lacks confidence in you and your skills. You lose the therapy time. Your documentation is not correct. You have difficulty with the perception of your colleagues. If you're doing co-treatments and you're disorganized, your colleagues are not going to want to work with you. So think of that also in your role as a student. Proofread before you hand something in. Make sure it prints 5 minutes before class. I can tell you I had a fieldwork student that ultimately failed fieldwork in part because of her lack of preparation. She would come to the sessions and she wouldn't have the printouts that she needed for that session ready. She'd ask me to print them. No, that's not my job. That's your job to come prepared. Or she would repeat the activities that I did because she did not prepare them independently on her own. So preparation is important. Ultimately, she did fail fieldwork. I was her second failed fieldwork, so she could not become an occupational therapist. So that's what I'm trying to highlight, the importance of preparation. Respect is another important competency, and there are lots of ways to demonstrate respect for others. As a healthcare provider, you demonstrate respect for your patients by recognizing and valuing their opinions, their beliefs, their culture, their background, their values. So as a healthcare provider, your primary tool is your therapeutic use of self, how you are able to relate to that person to help them be able to achieve the ultimate outcomes that they can. The most effective healthcare practitioners are able to establish that therapeutic relationship, and it's a relationship that's based on trust so that you can work most effectively with that client. So how do we demonstrate respect? We ask the individual, as I said, ask them her opinion, listen to their opinions. What are their thoughts about their own treatment? Again, be on time. That's a respectful, a demonstration of respect for that person, that their time is as valuable as your time. And leaving your personal issues, concerns, and biases at the door. That is absolutely essential. Everybody has their own lives, but when you're a healthcare provider, you need to check that at the door, because that person that you're working with deserves the best of you. All right, the next one is professional presentation. A little bit of this will be a review from Gen Med. You always have to be aware of the image that you're projecting. And being a successful healthcare provider is more than about the credentials that you have. And it doesn't matter what level of the profession you're at, whether you're just starting or whether you've been a healthcare provider for a long time. The image that you're projecting has an impact on getting a job, getting a promotion, getting a raise, your effectiveness, etc. So an image is the total impression that you have, and it goes beyond, just your physical appearance. It's also your voice, your attitude. What is the appearance of your surroundings, your work area? What are some activities that you engage in? Are you on your phone? Are you on your, acting distracted when you're with the person? Are you on your computer? And one important part of it is being aware of your personal values, beliefs, and biases. And I'm going to end this one for now, and we're going to start with the next one, and we're going to do a little bit of an activity.